Oh no, Matthew Holt, I think the bubble has burst. Teladoc stock is under 200. Amwell is flirting with its IPO price back and forth, and we only have one $100 million deal today. That's it. Is it the beginning of the end? It's the March 31st episode of Health in 2 Points. Oh no.
Well, Jess, it's all actually, you say it's all over. I was in like 3 Clubhouse discussions yesterday about how much money was there last week of the billions spent. It looks like you've taken some of your share of the money and bought shelving and boxes. Have you moved house?
I moved house.
You got a new place?
I got a new place.
So
Yep.
holding up in Jacksonville. Congratulations on the new place. That's very exciting.
Thank you so much. Just in time.
You've only been wandering around the world for what, 5 years now, and now you're putting down roots.
Mm-hmm. Yeah.
I give you.
That's where I started.
Back where you started in Jacksonville. I give you 6 months before you sell up and get on a plane back to Bratislava or somewhere. But
oh my God, it better be faster than 6 months. Now I've got a place to leave everything. So yeah, I'm ready to go.
All right. Well, I'll tell you one personal thing. As of April the 1st, which is in a couple of days, old men like me are eligible for getting shots in California. So after that, I'll be.
I can do better than that. Today, I found out that next week the vaccine goes down to 40. I qualify.
We both qualify next week. We have to be real human beings again. That's so exciting. All right. Well, that's so exciting. So let's say you have the new house. We're going to be vaccine eligible. It's a whole new life. But one thing remains the same. The clock says 2 minutes.
Oh my God, that was terrible.
Now it is go.
All right, let's go. Care Navigator Rightway gets 100 million. Coastal Ventures led this. Tigers in it, Thrives in it. Does this make sense to do this right now with Tolman and Transcarent?
Well, I mean, look, we had Tolman on. He says that there's a lot of room for this. They actually claim to be a care navigation company. They also have a PBM. They put the two together, and they're obviously trying to figuring out they can save money on the PBM side for their clients, do some transparency there, and do the care navigation together. It's been growing relatively rapidly. It's a relatively young CEO. His first real gig out of VC, he's a Goldman Sachs guy. First real gig after that. So, and they've got some excellent Mongo people on board. So it's exciting to see what happens there. But don't forget accolades in this. We've got the grand round things. There's a lot going on in that space. We'll see how it develops.
All right. AKASA gets 60 million, and this is a name change from a company that was called Alpha before. Their total is 85 million raised. What do they do?
Yeah, they're another one of the businesses, sort of back office, revenue cycle management, supply chain, God knows what, automation, AI for hospitals. Kind of like the folks at Olive who raised, I think, 400 million. So they're getting into that game. Andreessen Horowitz is in this one. So, not stupid people behind them.
Okay. All right. Viz.ai gets 71 million. Their total is up to 150.
Yeah, this is the diagnostic AI thing that helps you scan and figure out whether someone's got a stroke. Sounds incredibly clever. Sounds incredibly important. I know nothing about it.
All right. What about AppliedVR? Do you know anything about them? 29 million, total of 35.
These ones I do know about because they're in the VR space. You put the VR headset on, it gives you sort of a combination of new world cognitive behavioral therapy, and it's got a lot of good clinical results for pain. Brennan Spiegel and his colleagues down in the VR world at Cedars-Sinai are all over this one. And this I think has some. This is kind of a quote unquote digital therapeutic replacing opioids. Could be a big deal.
All right. What about Harmonize? They get 10 million. Basically nothing at this point.
Well, yeah, to be fair, little company. This is from the folks at Launchpad Digital Health, Fred Tony and his gang. What they're doing is they're another one in the remote patient monitoring world. You remember we had 100+ and Health Recovery Solutions a couple of weeks back, and they're aiming at, again, at sort of smaller physician groups and helping them with the whole remote patient monitoring. You're going to see a lot more of this. There'll be a lot more consolidation in that space as people figure out what can you and can you not charge for remote patient monitoring. under the Medicare codes, and how many can be the one doctor who gets the remote patient monitoring fee versus all the other doctors that same patient is seeing. There's a lot of stuff to be sorted out, but I mean, I don't know if they have anything special or not, but my sense is that that whole remote patient monitoring area, we're going to see a lot more money go into it, and then at some point we'll figure out, did it make any difference or not? Or is it like the chronic care management thing, which is related to it, which hasn't really done so well and had a couple of big flameouts? So we shall see.
Flameouts?
Yeah,
Right.
you remember CareSync? Amy Gleason,
Yes.
$65 million in, nothing out, because they couldn't get people to actually figure out, they couldn't get the patients to sign up for the chronic care management thing so the doctors could bill the $42 a month for them, because there was actually a copay for the patients in that. I think the remote patient monitoring thing is different. I don't think there's a copay for the patient. I'm not sure. But you still have the issue that somebody has to sign these people up. So if you remember, particularly 100 Plus said that what they had to do was they had to actually, be the people on behalf of the doctor signing up the patient and managing the process. And, it's first you have to sell to a doctor, then you have to sell to a patient. Even if the sale is free, it's still a complex process. So, we'll see how it goes. But those of us who, think the healthcare is moving towards the hospital and healthcare is moving towards the home, and believe in the ideas that, could be called the continuous, could have been renamed by somebody the continuous clinic, I think that in general this is a good idea. I wonder who did the renaming of the continuous clinic from the previously beautifully named.
Flickimo. That was what it was before, and it was an acronym, and I don't even know if you know what all of those letters stood for, because honestly,
Location, Independent Care Management Information Organization or something. I forget what it is.
Every single time it was different. You just like make up a different.
But Flickimo sounds so good until you change it.
Collaborative, delivering the right care to the right patient at the right time.
I never said that. You said that.
Our patented AI technology delivers
on the blockchain. It's all good.
On the blockchain, using the very latest.
So you have a bit of unpacking to do.
Learning technology.
Yeah, you have a bit of unpacking to do and some furniture to move, and I suspect your pod must have arrived.
The pod was lost, but it has been found and it has been unloaded, and now I just have to cut everything out of the plastic that is living.
All right, well, you better run away and do that, so get us out of here.
Yes, I will. All right. For more fun and adventures, please follow along with Bolty Boy over there on Twitter. And to see what I'm up to, I am at Jess DeMassa. And to never miss an episode of these cute little Health in 2.0 shows, which are making sense of the wide and adventurous world of health tech funding, please go to thehealthcareblog.com and sign up for our email newsletter there, or subscribe directly on YouTube. Mr. Holt, I'm so happy to have my real official desk back and have a new place to broadcast from. Yay.
Congratulations, Massa. We'll see you next time.
See you guys. Bye.